And thank you to Anne and Ciara for your wonderful chairing. And I'm glad that the next session we're moving into is going to take up some of those points of climate action and climate activism. And we're going to look at the Lancet Countdown report that was launched just yesterday. So the Lancet Countdown is a research collaboration for monitoring progress on health and climate change in Europe. With the wealth of data and academic expertise available, the collaboration develops high-resolution, region-specific indicators to identify and address the main challenges and opportunities of Europe's response to climate change for health. And then the indicators provide information for policy decisions, particularly and contribute to the European Observatory on Climate and Health. So I'm delighted to hand over to Tim, he's the Chief Executive for the Irish Heart Foundation. He's a former general practitioner, government special advisor, and he's the national and regional radio station CEO. What an interesting mix of background, Tim. In the 1990s, he was a special advisor to the government's Minister Mary Harney and Brendan Howlin at the Department of Health and the Department of the Environment before he went on to become Director of Public Affairs with Drury Communications. He's also a qualified barrister and held a degree in medicine from Trinity College Dublin. The Irish Heart Foundation was a founding member of the Climate and Health Alliance, which has been active in highlighting the co-benefits for health and climate action. Tim Collins, we're absolutely delighted to have you here to take up those points of climate change in this session. Over to you.
Well, thanks, Nadine. That was just such an inspiring session. It's certainly put a challenge to us to follow. Both Robbie and Mike really have set the day up so well. As you've said, this session, the second session of the day, focuses on the 2022 Lancet Countdown on Health and Climate Change report and policy briefs. And just a little bit of background in terms of where this report comes from. The 2015 Lancet Commission on Health and Climate Change's conclusion that tackling climate change could be the greatest global health opportunity of the 21st century highlighted the need for a global monitoring system with the ability to engage policymakers and support health professionals. In 2016, the Lancet Countdown tracking progress on health and climate change was formed to address that gap. And the 2022 report is, and I read it last night, it's a pretty stark wake-up call in terms of the lack of progress made over the last 7 years. But on a positive note, and I think Mike underlined that, we're in a difficult situation, but the last thing we should be doing is focusing on a doom and gloom scenario. We need to look at, what are the positive things we can do to get out of it. And so in spite of the grim headlines in this report and everywhere else about the Russian invasion of Ukraine, a global energy crisis and an escalating climate crisis, this latest report does offer some hope in terms of a health centre response to the current crisis, providing an opportunity for a low carbon resilient future, which not only avoids the health harms of accelerated climate change, but also delivers improved health and well-being through the associated co-benefits of climate action. So we're privileged to have one of the authors of the Countdown report, Professor Karen Morrissey, as well as public health consultant, Dr. Ina Kelly, to guide us through some of the main findings and outputs of the report. We're meant to have 45 minutes. By the clock, we've got less than half an hour, but we might have to stretch it a little bit because I know both speakers have lots to say. Karen's going to kick off and then hand over to Ina, and we can do, if we've time, we'll do some questions and answers. So just to introduce Karen. Karen is a professor in applied economics at the Technical University of Denmark. An economist and econometrician by background, she previously worked in a department of geography at the University of Liverpool and a medical school at the University of Exeter. She situates her work as an interdisciplinary methods-driven scientist in the field of human health and environment. Her research is specifically driven by policy, as demonstrated by her work with the Lancet Countdown, where she's co-author of Working Group 2 on Adaptation, Planning and Resilience for Health. And her career highlights include being made a fellow of the Turing Institute in 2018. She has contributed to more than 85 publications and attracted over more than 20 million in external funding. So I'm going to hand over to you, Karen, and then I'll introduce Ina after your presentation.
Hi everyone, thank you for that introduction, Tim. I wouldn't have wrote so much blurb in response to Maisie's.
I shortened it actually.
Yeah, you did shorten it. If I knew it was going to be read back to me, because I sound like an absolute asshole, but
Yeah.
I promise I'm not.
Oh, it's good.
Yeah, so I'm going to start by sharing my screen, and I assume that straight away you can see that despite being based in Denmark, in Copenhagen, I am very much a Galway girl. I should have maybe worn my t-shirt. I'm on my second one of those. So can you guys see my screen? Yeah, great. And I'm going to put that up. So what can you see? Can you see my cheat sheet or just the actual slides?
We can see the cheat sheet and the slides.
Oh, okay, so there the cat is out of the, let me see, I need to swap displays. So there we go. Okay, great. So I'd like to start by thanking everybody for the Irish Global Health Network for inviting me to introduce the 7th iteration of the Lancet Countdown. It was just launched yesterday, so it's quite hot off the press. We are coming out this year, I think, with a very strong message, and I'm going to take you through that over the next 25 minutes. So, as Tim said, the 2015 Lancet Commission concluded that anthropocentric climate change was the greatest threat to human health, and it will be in the 21st century. And if we manage to get into the 22nd century, the same is true. And each year since that, we have published an annual report that's tracking our progress. So we're trying to be positive about this. We're framing it as if that we have the ability to reverse the damage we have done. We bring together climate scientists and geographers, mathematicians, physicists, transport and energy experts, development experts, engineers, economists, social and political scientists, and health professionals across 5 working groups. If anybody knows anything about academia, which I'm sure you all do, the fact that you've got so many different disciplines working together is shocking in itself, and just goes to highlight how the evidence that we present, we can all get on board with. This is not the evidence of one, the yogurt eating hippie or activism that we had in the 1970s. This is everybody getting behind a message across all disciplines. We work across 5 different working groups. So whilst there's over 100 scientists, we are working at different groups. Working group 1 looks at the health impacts of climate change. I'll introduce some of those. 2, which I'm involved in, is looking at our progress in terms of health adaptation or lack thereof. Working group 3 looks at mitigation and at the co-benefits. There's huge co-benefits to actually dealing with health co-benefits to deal with climate change in the here and now. 4 is the economic costs associated with climate change, and 5 is the broader economic and political context, which I won't really touch upon that much today, but happy to answer any questions. This tracks public and political sentiment in terms of climate awareness and climate actions. So what our latest report concludes is that the world faces a critical juncture for all the reasons that Robbie, Dr. Mike, and you guys, I'm sure, spoke about yesterday. We are once again in the middle of a huge global crisis. We've barely come out of COVID, and we are, in terms of climate change and what we can do about it, we are at a critical juncture, whilst we're also tackling these convergent issues. We have a persistent fossil fuel addiction, and it is amplifying the health impacts of the concurrent crisis we face. The energy crisis has really put energy policy and the need to move to renewable, secure, more secure energy provision in the short term and the long run. But actually, climate scientists have been saying this for the last 20 years. It's not, if only we had moved to renewable energy a little bit sooner, we would have actually at least missed the hard impact that we're now facing. And I notice many of us are joining with our lights turned off. And I actually have my hot water bottle with me because I don't want to turn on the heating. So, you know, this idea of us all being in it together. So, but our persistent fossil fuel addiction is driving a rapid increase in the negative health impacts of climate change on the health and well-being of every country. People are seeing their health increasingly affected by climate change, either through the exacerbation of food insecurity, which is something that I actually have a lot of worries about, extreme heat exposure, drought and wildfires, a heightened risk of infectious diseases, and an increasing number of life-threatening extreme weather events. And the delays, as I said, in the uptake in equitable access to clean energies has left households dependent on the use of dirty fuels, vulnerable to the increases in the fossil fuel prices and exposed to energy poverty. We're actually speaking about poverty now back to speaking about poverty in high income countries, where once we were speaking about relative deprivation. And I just want to point that it's not just our addiction to fossil fuels is not just highlighted by our focus on energy, where we get our heat, where we get our transportation fuel. Fossil fuels are pervasive. They are in everything we use. The plastic crisis and the microplastic crisis that we face today is underpinned by our addiction to fossil fuels. So whilst we're seeing it, we're at the cold face in terms of keeping ourselves warm, our addiction to fossil fuels is pervasive across all sectors of society. It's not just the energy sector. And governments and companies continue to prioritize fossil fuel interests to the detriment of people's health and well-being. And this is our key message from this year's Lancet Countdown. We have a new indicator that looks at relative subsidies and the relative subsidies to fossil fuel companies and the relative direction of these companies into the future. We have engaged in a profound lack of funding in terms of clean energy. With a different hat on, about 12 years ago, I met with the Irish Gas and Oil Federation, a very small federation compared to, say, the UK, etc. And one of the things that really struck me at that time was that the lobbyist, the person I was speaking to, turned to me at the end and said, listen, if renewable energy was the way out, already we would have been developing money. We'd have put all our money into it. However, and I found that, and that has stayed with me, because I could never understand at the time, was he so short-sighted, or was that a lobbyist point of view? And I think it was a little bit of both, maybe the lobbyist point of view. But we have continued to underfund our move to clean, zero carbon, affordable energy. And diving into the indicators, I'm going to start to highlight this with one of our new indicators. Carbon dioxide is responsible for around 3/4 of total greenhouse gas emissions. And we know that climate change has direct impacts on human health. Reducing CO2 emissions is key. It is a key it is the key to at least stemming the tide of climate change. And what this indicator shows is connects CO2 emissions to the activities of major oil and gas companies. These are the companies that, if you look on their website, if you look on Shell or BP's website, you would swear that they're a renewable energy company. You know, the whole their websites are wind turbines, etc. However, what this indicator finds that the current strategies of 15 of the largest oil and gas companies, and we're speaking about companies that are richer than God, basically, would lead to a production exceeding levels consistent with the Paris Agreement, so that actually we would miss our global targets limiting surface temperature to 1.5 by 37% in 2030, and this becomes exponential by 2050 if we allow the oil and gas companies to do as they are doing. We are going to have 103% increase in temperatures by 2040. 2040 is around the corner. Mia will be the same age as I am right now. And I like to think I'm in the prime of my life. Another indicator is net value of fossil fuel subsidies and carbon prices. And I'm happy to come back to this because maybe it's a little bit tricky to understand. But looking at 86 companies who are responsible for 92% of global CO2 emissions. So these are the 86 top producers of CO2 emissions. This indicator shows that 80% of these countries have a net negative carbon price. So they are effectively subsidizing fossil fuel companies. And this has really come into the headlines in very tangible ways over the last few months when we speak about price caps, etc. But we really need in high income countries to stop subsidizing oil and gas. It's not even cheap anymore. And when you look at the health impacts, it was never a cheap option. And the resulting net loss of government revenue from subsidizing these actual companies, which don't need to be subsidized, is equivalent to a huge proportion of nations' national health budget. In fact, the median subsidy provided by these 86 countries is 1.6 billion, and 10 companies in particular give a subsidy of 10 billion net. In 31 countries, these subsidies exceed 10% of the national health spending and exceed 100% in 5 countries. Governments, as they stand, are subsidizing these oil and gas companies to the detriment of our health and the development of renewable energy. In terms of the energy system, which we're all very focused on at the moment, are the largest single source of greenhouse gas emitters and are major contributors to air pollution. And as you can see from this graph, I hope it's somewhat clear to people that it's the difference between the countries that are classed as with a low human development index and high human development index is vast. The carbon and the in terms of the emissions from our energy system, the global intensity of the carbon intensity of the global energy system, basically what is fueling us right now, has only decreased by less than 1% since 1992 when we put the UNFCCC, we adopted it. Energy-related emissions of CO2 has reached a record high in 2021. They decreased during COVID and completely rebounded. They just sat dormant, waiting for us to continue as business as usual, which from a health perspective makes me very literally sad, as there was no lessons learned. It was clear that there was no lessons learned. This is something that's very, very clear to, very dear to me at the moment. Not at the moment, but it's our role. It's the micro level. So I've spent a lot of time speaking about how governments are subsidizing the fossil fuel companies, but actually us as consumers and us as countries as producers, the production of goods and services is driving greenhouse gases and PM2 emissions. In 2020, the very high countries with a high human development index contributed the most consumption-based. So the goods we buy have carbon embodied in them. 50% of those carbon emissions are consumed by households in by us in wealthy countries, whereas who we are producing them, who's actually producing them, is the countries in the next lower. So we have a huge transfer of where we consume and where we produce the goods that we are consuming. And as households, we need to look at our choices. Remember what I said at the start. Fossil fuels are not just underpinning the heating or our lights, they're underpinning everything that we buy. So to turn this a little bit in towards the global balance and social inclusion aspect of the conference, I highlighted, I'm going to speak about a number of indicators that just go to highlight this global imbalance. And I'm sorry, but there's very few social inclusion. It's mostly social exclusion examples. So as I mentioned, food security is a #1 concern. It's increasing globally. It is matter of fact, as much in high income. It's not as prevalent, but it is a matter of fact in high income countries as it is in low income countries. Mia, unfortunately, who seems to be the persona for this conference, she will face, and her generation will face, not just food insecurity, but food rationing, drought, and quite possibly hunger, if we do not stem the tide. And that's irrespective of where the child is born. Of course, it's going to be worse in low and middle income countries, but living in Europe is no longer bestows the idea of plenty of food for all. Compared with in over a 20-year period, increases in the number of heat wave days resulted in an increase of 3.7 percentage points in moderate to severe food insecurity in 2020. What I really hope that people have understood since the Ukraine conflict is that no country it looks after its own food. Food is, even though Ireland, we are still an agricultural country underpinned by strong agricultural industry, all our food is globally, and particularly within Europe, provided. So we need to, when we think about heat waves and we say, well, that's not our problem, we don't suffer from heat waves, if only actually the food that we consume is being impacted by these heat waves, irrespective of where they're taking place.
Karen, I might just come in there. We're running very
over time. Yeah.
So if you could run through your last few slides, and then I'll hand it to Ina, if that's okay.
Yeah, absolutely.
My apologies.
My apologies.
Ryan.
Yeah, no problem. And actually, it's all, as I said, it's not a particularly pleasant site, and please do read the rest of the report. Okay. But children under 1 year are heat waves, and those that are particularly vulnerable for heat waves, the elderly and newborns are going to be particularly exposed. Mortality rates are going to increase in this area. We're going to see higher rates of mortality from ambient air. We're going to see more heat-related mortality, and the costs of this are increasing pretty much year on year. The lethality of extreme weather events, flooding is a huge issue in Ireland, and our cities are going to be where we see the biggest impacts. And unfortunately, any of the climate mitigation actions that cities had put in place over the last number of years have really been hit by COVID with funds, a lot of funds diverted. But there is hope. We are starting to invest in clean energy, but coal phase out is essential, and we are seeing governments starting to backslide. Employment in low carbon and high carbon industries, we can no longer say economic progress is dependent on a carbon economy. Low carbon economies are shifting to be the main labour supplier and economic driver of globally. This is not just about, the low carbon economy is not just about eating seeds and having soy milk. It is actually, it can be a global driver of what we consider progress. So I'm going to end it there, and just to remind everybody, unfortunately, that global health at the moment is at the mercy of fossil fuels. And we have to, going back to what some of the sentiments from this morning, civil society needs to speak louder about this issue. So thank you very much.
Many thanks, Carolyn. That was a really good run through of obviously what is a pretty substantial piece of work. I know we have a few minutes, so I do want to bring you in. I'm not going to do a big long introduction. I think most of our audience here know you and know your face. You know, you've been very much involved in the whole issue of climate and health, and I know that you're part of the Climate Change Advisory Council Adaptation Committee. So you've got a commitment and an interest in this area. So I'd just like to hand over to you. We can take a few minutes where I think we're entitled to run into the next session a bit. So fire ahead.
Okay, thank you. Thanks very much. I'll share my screen here now if I can. I'll see what comes up there. Is that working okay for, no, it's not really coming up. It's not coming up as a slideshow yet. Okay, how do I change that? I've no notes anyway there. If you just forgive me, I'll try and be really quick on this one. But
we're good,
just to say, I've been asked really to talk about what we're doing within the health sector in Ireland. And I know that really I'm a public servant, so my duty is to look after the public health of the people within the country. But of course, we're very conscious of the fact that that also has an impact on people in other parts of the world as well. And we also, you know, we would have strong links with global health colleagues as well. But I just say something about this, that obviously within the health sector, we have two things. We've got the health impacts of climate change on the left there, and then that the health sector itself is a big, you know, user of products and can be a key contributor to fueling carbon emissions as well. So the answer to that really in a way is to have sustainable healthcare and also adaptation, so that we need to try and make sure that we can reduce the health impacts that we're concerned about. And I think Karen already mentioned some of them there as well. And I think we've been talking about them for quite a while, but they're vast and they can nearly cover almost any area as well. But in Ireland, really, we have looked at what we think that they may be, and considering, I suppose, we are expecting increased precipitation in certain parts of the year and more extreme weather events and so on. And so we know from other countries that excess mortality is something that you know, has been a huge problem in heat waves. Though in Ireland, we, I think, seem to have missed most of that yet. But you know, the way the trajectory that's happening, we'd be very concerned about that. I think obviously during extreme weather events, from a healthcare perspective, you know, there's a lot of disruption to essential healthcare, which puts more and more pressure on the health system. We already have long waiting lists and so on, and you end up cancelling and people, you know, struggling during that period of time. And we can't afford that within the Irish healthcare system, really, because we're already struggling in many respects. And say we obviously foodborne disease we're concerned about. It's very difficult to maintain cool temperatures during hot weather and so on. A waterborne disease from precipitation, we're likely to have increased contamination of untreated water supplies, for which Ireland is unfortunately depends. You know, nearly 20% of our population depend on drinking untreated water supplies from private wells. We have a very particular issue there. And of course, we have a very large reservoir of zoonotic diseases in our cattle density in Ireland, which is very high. which can cause some of these infections. And then we have asthma. Ireland's a high prevalence country for asthma, and so we would expect that with the longer pollen season and so on as well, that may become worse. And then air pollution is something that obviously, we'd like to be able to control it, but obviously, like during heat waves, for instance, you'll end up more likely to have wildfires and so on that will just put that out of control as well. So the Department of Health, as part of all of whole of government really, developed a plan in 2019, and we're focusing on some elements, so like UV radiation and sun exposure, with the skin that many people in Ireland have, which is very vulnerable to sun exposure. That's something that actually is important because it's one of our biggest health impacts anyway. And people are inclined to expose themselves more when the weather is warm. Worsening air pollution, I think due to climate change, that's something we need to be very watchful of. And then of course the extreme weather events. So so the Department of Health have put that into place. And then really in 2022, and I suppose we've come out of 2.5 years really of the health sector being completely convulsed really by the COVID pandemic, which required us to focus priority on that. So you can imagine that the adaptation planning wasn't really implemented. So this strategy has been developed in this year, and it's about surveillance, sustainability and adaptation.
Aina, could I ask you just to move down through?
I will indeed.
Yeah,
and they're the main actions really.
Yeah,
Five actions are sustainability, and one of them is adaptation and resilience.
Yeah.
And there are some achievements that are occurring. They're small though, relatively speaking, but they are happening, and there are percentages being knocked off. Some of our duties, we are starting to make some efforts there, but there's a long way to go yet in this. So I suppose our COVID learning though has been very helpful to us, because we recognise that the workforce is very willing to do an awful lot and can be a great agent of sustainability. And we have got potential to do a lot more. So we're hoping, I suppose, in the next few years that we're going to really make a big difference in this area. But, we do need some resourcing for that as well, because it has to become a priority. And one of the things that I am cheered about is the fact that there is within the wider, in the HSE, that there is a recognition that prevention is actually key, because you don't need to have healthcare if you've actually prevented health issues to the greatest extent possible. I mean, you don't need to have as much healthcare. So that's really important as well. So I'll just finish up with that. And thanks to Roisin for her slides. So I'll come out of the sharing there. Stop share. Thank you. Yeah. Okay. I hope that's come off the screen there for you.
Look, thank you both for that. And sorry to have to rush you through. We can take a couple of minutes, and I think we can take any questions that there are. Mm-hmm. I might ask you both a question. We've seen lots of policy movement from governments. Our own government has a climate action plan and so on. But the idea of a health-centred response to climate has been kind of largely absent. In this country, we've had a lot of action, for instance, recently on trying to ban the burning of solid fuels. And thankfully, we managed to insert the health argument into that. And it was actually a major driver in moving a lot of politicians along. It was less the environmental issue and more the actual health impact directly on people. But we've recently had a big debate in this country about, for instance, agricultural emissions, and the health aspect of that was completely absent. There was no discussion at all about what is a sustainable diet and how do we actually, shift our agricultural system to actually provide sustainable diets that are actually healthy as well as not damaging to the environment. So, to you both, how do we actually, move the public discourse over to actually looking at a health-centered response? Because it strikes me that it could be an incredibly potent driver to actually shift public opinion. So maybe Karen, you might.
Oh yeah, somebody has already unmuted me. Thank you so much for that. This very much goes back to my sort of call around the production and consumption aspect of it. To me, the population and consumers have a lot more power than they actually realize they do to shift production and consumption. If we shift shift production and consumption to more health, climate resilient or climate safe food, goods and services. So for me, we need to, I think we need to stop looking at one section of society. So agriculture and healthy diets, it's always trotted out, and for sure this is a key issue. But if you look at the breakdown, we have huge emissions across all sectors. So we need to take a more holistic view of this and look at what the health co-benefits of moving to a more sustainable society will be, because it's actually it's an easy way. People do not understand when you say, or they do not care if you say this little critter who has 2 heads is going to be extinct in 5 years. However, if you say to them, asthma is going to increase, your asthma probability is going to increase, they sit up and take an actual, take notice. So for me, the linking of health to climate change is a no-brainer for governments if they actually do want to do something concrete, rather than just seemingly not just, you know, prayed out the usual messages.
I know. How do we get that health co-benefits message out? Just either falling on deaf ears, or it's not even on the agenda.
Yeah, I think if what Karen was saying there about, you know, if they really want to, I'm not sure that they really want to. That's one of the issues. I think we need to look at the barriers. Why do they not really want to? What are the motivators of the decision makers, really? And I think there are, you know, obviously, you know, the people who, most of us here are, you know, we've limited resources to be able to get there, to be heard and so on, and to be able to provide, to build something, whereas the powerful lobbyists are there and with lots of money to do so, and they're being heard all the time probably. I think why are there difficulties? I think there's a distance from the effects of policies. I think what you're saying though, Karen, about we should definitely make it visible, but I know I talk about, like, we have the highest rates of one of the serious zoonosis, Toxigenic E. coli in Europe, and I bring it to the attention of my colleagues at senior level all of the time. And I'm afraid it's like once you've pointed the Titanic in one direction, it's very hard to turn it around. Maybe saving face is one of those things where people don't like to turn around policies. There's an awful lot of investment in particular. And I think with agriculture, you see, you do have to come down to the specifics at some time as well. And I think with agriculture, for instance, there has been a real push and huge investment and pushing farmers to invest in a particular direction, which is very hard to turn that around, because unless you're going to have a really strong just transition or just resilience where people are funded and invested in to make the changes, I'm not sure that that's, you know, it's seen as extremely divisive almost, unless you can see that there is an alternative plan where it's better for everybody. So we can have health co-benefits, but actually if a lot of people are going to lose their livelihoods and so on, or they feel they're going to lose their high livelihoods or whatever, they aren't going to be fond of that, you know, that they're not going to be pro that, and you know, and they have strong lobbyists on their behalf, obviously, which is important. So I do think that we do need to understand the barriers and come up with the solutions to those barriers and bring in the solutions for those, you know, how to turn it around, because you know, we know that those things are important, but actually they don't get, I feel that they don't get any traction. Health benefits don't get traction in certain respects. If the agenda is, if that's a very uncomfortable message, and there's nowhere for it to fall really as well, you know, that's a problem. So I think we need to look at that.
Yeah. So if I may just answer back, I think the main barrier, and this is what we're trying to say in the Lancet Countdown, but one of my main fears for this year's message is that it's just a bit too glamorous, you know, persistent addiction to fossil fuels. It's very taggable, it's very hashtagable, and if you don't think about, you know, it seems like it says everything, but for many, it will mean nothing. And actually the main barrier for governments is that all our sectors, agriculture, transport, are dependent on fossil fuels. And we have failed to try and look at alternatives because they were so cheap for so long. And we didn't take into account the environmental impacts or the health impacts. And now that we're taking these into account, governments can't understand it. They're like, what do you mean that, you know, it's actually going to be X billion? That's not real money. But actually it is, because what our addiction to fossil fuel, which is the main barrier, is actually driving morbidity and mortality.
Look, I think I'd just like to thank you both. I think that, you know, that last point is probably very pertinent. Robbie Lawler talked about transformation in times of crisis, and we're in the middle of an energy crisis, and it'll be a sliding doors moment globally. We'll either use it to make a major shift into renewables away from our addiction to fossil fuels, or we'll burn more coal. And it strikes me that we're on the verge of burning more coal, but hopefully the renewables will win out in the end. So I'd like to thank you both. My apologies for truncating the session. I know that both of your presentations will be available to people afterwards, and but I think that you brought up a lot of really interesting topics, and I think that they'll obviously be discussed throughout the day as well. So thank you very much, and I'll hand back to Nadine.
Okay, thanks everyone.